Foot ulceration is a major complication of diabetes. Many people delay presenting because they've lost the gift of pain and it doesn't hurt. Left untreated, this can be the beginning of a path to amputation, loss of the lower limb.
Without question, underrepresented minorities have a higher incidence of not only ulcers, but also major amputations. And in fact, they have a higher prevalence of diabetes as well. And it's really an issue with access to care.
We're not getting to these people early enough before the ulcers become complicated. People without good quality care, without good diabetes education, are at high risk for diabetic foot ulcers, which are the precursors to diabetic foot amputations.
There have been precious few effective therapies for looking after diabetic foot ulcers. It's exciting that things are improving now over this last decade and certainly over these last 5 years.
AOTI stands for Advanced Oxygen Therapy, which was a company that was formed about 10 years ago to commercialize and develop a unique topical oxygen therapy that sustainably heals chronic wounds.
What we're passionate about at AOTI is to find solutions that will essentially allow patients who have a diabetic foot ulcer to lead a better life.
The recurrence rate for diabetic foot ulcers is terrible, sky high, over 40 or 50% after 1 year. So if we can decrease that rate using this technology, we help so many patients.
Topical wound oxygen, TWO2, is a unique multimodality therapy that combines higher pressure cyclical oxygen with non-contact compression and humidity.
We have a chamber that we place over the limb, and then we seal that chamber, and then we can inflate the chamber to help reduce edema and help move blood flow down the leg and back up the leg, while at the same time causing oxygen under pressure to go into the wound bed to promote healthy granulation tissue and wound healing. By being able to do these things, we can heal these wounds faster and more sustainably.
TWO therapy is very easy to use and is commonly applied by patients at home. This is critical both to compliance, but also in addressing access to care.
All the provider has to do is write the order, and we take care of delivering it to the patient, explaining it to the patient, make sure they understand how to use it, and we follow up with the patient on a weekly manner and deliver information back to the provider on how that patient is doing.
Over the last 10 years, our therapy has been validated in the most rigorous clinical trials.
We have a real-world evidence study that was done on patients in the VA that have chronic, hard-to-heal wounds, an 83% reduction in hospitalization rate, a 71% reduction in amputations, the only variable being this oxygen modality.
To date, we have treated over 20,000 patients at home, and the patients have applied our therapy over 2 million times.
Traditionally, patients would have to go to a facility and stay in a hyperbaric chamber, if you will, for several hours, 5 times a week. This can be done at home, and the effectiveness seems to be equal or better.
We had a 95 to 97% patient satisfaction for the use of this therapy. And with that satisfaction went with compliance or adherence to our protocols.
With topical oxygen in a randomized controlled trial, not only one but several, showing potential to speed up healing, this is going to be a big step forward.
All the data are pointed in one direction, suggesting that we can dramatically reduce costs, not just for individual patients, which of course is where we aim, but actually for entire systems.
Patients with chronic disease account for the vast majority of healthcare spending. By more durably healing those ulcers and lessening their reoccurrence, we have direct impact on health economics and cost savings.
We can look at driving savings for healthcare systems in the region of 25 to 30% versus current practice. We can provide access to patients in lower socioeconomic sectors of society, much more so than solutions that have to be done in hospital settings or higher cost settings that often have high co-pays attached to them.
I think AOTI, through its efforts to really focus a lot on research as well as education, I think their future is very, very bright.
Diabetes in itself is going to carry on growing, and so the requirement for care is going to continue. What we are looking to do with AOTI is to establish two as a standard of care for diabetic foot ulcers, so we can provide access to as many of those patients as is possible to help with their lives and their livelihoods.